Good afternoon. Myself, Madhusudan Rao. Today we will be discussing about abnormal psychology. Block 3, Unit 7, Schizophrenia. We would be covering clinical description or symptoms of schizophrenia, various types of schizophrenia, etiology of schizophrenia. I'll try to share a PowerPoint where it would be easy for you to understand it slide-wise. So in general terminology, if we can say depression is the common cold of psychological disorders, then schizophrenia is the cancer. By this statement, one can understand the severity of this disorder. According to WHO reports 2002 states that nearly 1 among 100 are affected with schizophrenia worldwide. So let us try to understand how many are affected around the world. Schizophrenia mainly affects men over women. That is, if 10 individuals are affected, in that 6 are men, 4 would be women. This is the ratio. Similarly, men are diagnosed slightly earlier than women. What is schizophrenia? Schizophrenia, major disturbances in thoughts, emotions, and behavior. Disordered thinking, ideas not logically related. What that mean? There is no logic between ideas, faulty perceptions and attentions. Lack of emotional expressiveness, inappropriate or flat emotions, disturbance in movement or behavior. So they don't know, or they does very peculiar their movements or behavior is completely odd from the regular ones. Which can disrupt interpersonal relationships and diminish capacity to work or live independently, like personal, family, social, educational, occupational, and other areas of life. Once a patient is affected, so his functionality will be definitely not normal. So his coping up skills are deviated or compromised, and he cannot perform, due to which there are high chances of them committing suicide or self-mutilation can be seen. According to DSM-5, two or more of the following symptoms persist for at least 1 month. Of any of these, 1, 2, 3, 4, 5, that is delusions, hallucinations, disorganized speech, disorganized behavior, that is catatonic, negative symptoms. Then, where in functioning work, relationships, or self-care has declined since onset. Signs of disorder for at least 6 months, that is, if duration of prodromal or residual phase, negative symptoms or 2 or more of the symptoms, that is 1 to 4, less severe form. Residual form phase means once symptoms are identified and slowly they come down, maybe because of treatment or maybe some reason, but they persist. So what are the different types of schizophrenia? There are 3 major types of symptoms: positive, negative, and disorganized. Positive symptoms: delusions, hallucinations; negative, violation, alogia, anhedonia, blunted affect, asociality. Disorganized behavior, disorganized speech. We will discuss them in later slides. Positive symptoms. What are positive symptoms? Anything which is excess is positive. Behavioral or speech or anything, actions, which is anything excess is called positive symptoms. Sorry. Like firmly held beliefs contrary to reality, resistant to disconfirming evidence. Firmly held beliefs, what does it mean? Simple. If I tell somebody affected, schizophrenia affected a patient, Earth is round, and he says, and he believes that Earth is flat, and he argues, and he doesn't want to see any evidence to what I am trying to explain him. He is blunt and simply argues that Earth is flat or boxy. That is bizarre beliefs. Types of delusions: persecutory delusions, thought insertions, thought broadcasting, grandiose, etc. What are persecutory delusions? Excuse me. Persecutory delusions mean an individual believes that some CID, CBI, some organizations have planted a device in their head and they are controlling or reading his brain, etc. So 65% of the people are affected with such delusions. Similarly, thought insertions, they think somebody is inserting thoughts into their brain or them. All the thoughts are not their own. Somebody else is instructing them. Something like that. Thought broadcasting, their brain, their thoughts are being broadcasted to everybody. They think their mind has been read by everybody and that has been broadcasted. Like we broadcast All India Radio, television, something like that. So apart from that, the other one, grandiose. These are most famous and we have seen in many movies too. Grandiose delusions, the affected person feels themselves to be related to most famous people or they themselves are the most famous people. Like, for instance, they feel themselves, they are born as the next incarnation of Buddha or Gandhi or Nelson Mandela or some movie star or some king. And this grandiose also includes, they have some special powers. Like they can banish somebody. Of course, they do that because their thoughts are bizarre. They see things which we can't see. And they feel that they have that power to their hands and thoughts. Next, hallucinations. Delusions, hallucinations are two different things. Don't get confused with delusions and hallucinations. Hallucinations, sensory experience in absence of sensory stimulation. Sensory experience in the absence of sensory stimulation. There is no stimulation, but they have those experiences. They can see, act, like 74 symptoms, 74% symptoms are auditory. The affected person can hear voices around him, talking to him, instructing him, asking him to do. If you can recollect, there is a movie called Munabai MBBS. That's a different scenario. That hero is not a schizophrenic, but that's how schizophrenic patients see. Gandhi coming to him, talking to him. So all these things happen to them and they see people and talk. Increased level of activity in Broca area during hallucinations. Broca area where excessive dopamine is thrown are released, receptors are not accepting them. So as a result, there is no much action going on. So hallucinations occur, due to which distorted speeches will occur. For example, children in younger age, they see people around them, talking to them. Later on, this will go off. Why? Because children with lesser activity or maybe minimal activity in Broca area create such hallucinations. Once they grow up, these thoughts or hallucinations vanish. So earlier we were talking about illusions, types of illusions, types of hallucinations. Now coming to a violation. Lack of interest or apathy. Lack of interest, what does it mean? Whatever you talk, it may excite you or people around you, but not the affected person. And they don't show that apathy. No reaction, positive or negative. They simply show no emotional reactions. Asociality, inability to form close personal relationships with anyone. That includes even family or colleagues. Anhedonia, inability to experience pleasure, compensatory pleasure, anticipatory pleasures. Blunted affect, exhibits little or no effect in face or voice. If somebody comes to him telling him that, him or her, that your child has fallen down and he badly got hurt, the affected person doesn't react facially or verbally. They simply show no reaction at all. This is called blunted affect. These can be grouped into two domains. The first, evaluation, asociality, and anhedonia can be grouped into experience. These can be experienced. The other two, blunted affect and elogia, are into expression domain. Elogia means reduced in speech, poverty of speech, you can say. They talk very minimum. They respond very, very less to no matter what the situation is. Now coming to disorganized symptoms. Disorganized speech, formal thought disorder. Incoherence, inability to organize ideas. They have ideas, but they are not able to organize them properly, or bizarre ideas which are not at all proper. Loose associations. So they speak with somebody on a topic, immediately they shift the topic, or they jump into another topic. They move on jumping and they forget what they were talking prior to that, or what they will talk after that. There is ramble or jumbling or completely no coordination between the topic where they are talking. Disorganized behavior, odd and peculiar. Behavior here, their way of dressing, how they speak, how they protest or whatever. Dressing unusual, just imagine. I've just given an example of wearing several heavy coats in hot weather. Similarly, no clothes in cold weather. Or wearing odd combinations, like wearing a frock and a men's shirt with a tie or t-shirt with a tie, etc. So behavior is completely disorganized. To catatonia, motor abilities, repetitive complex gestures, unusually twisting their fingers, which normal people can't do, but they do that. Or hands, excitable, wildly falling of limbs, just simply throw their hand, which is really abnormal. Like, catatonia, immobility, maintain unusual posture for long period of time, like standing on one leg, lifting their hand, pointing out on this towards the sky, standing for hours together, or sitting in a chair twisted towards the window, looking for hours together. They simply do that, where a normal person can't do. That hurts them, but physically they can take the pain. Waxy flexibility. What does it mean? Limbs can be manipulated and posed by another person. If you see, if you have an opportunity, go to the mentally retarded hospitals, and you can find schizophrenic patients where their limbs are differently arranged by themselves. As such, they are walking on somebody's legs, or they are using someone's hands. Completely different positions. So other psychotic disorders, there's the prior, what we were talking were three major types of schizophrenia. Other psychotic disorders. Schizophrenia form disorder. What does it mean? Same symptoms of schizophrenia. Symptom duration greater than 1 month but less than 6 months are called schizophrenia form disorder. Symptoms must include either hallucinations, delusions, or disorganized speech. Brief psychotic disorder. Symptom duration of 1 day to 1 month, often triggered by extreme stress such as bereavements. Symptoms must include either hallucination, delusion, or disorganized speech. Schizoaffective disorder. Symptoms of both schizophrenia and either a depressive or manic disorder. Symptoms of a major mood episode are present for majority of duration the illness. There is one more, delusional disorder. Delusional may include, in this, delusions may include persecution, jealousy, being followed, erotomania, somatic delusions. Persecution, as you know, somebody is, persecution, somebody is harassing or something, following continuously, etc. Jealousy, yes. his or her boyfriend or girlfriend or wife or husband, they feel jealousy of them, or they feel they have a doubt that they are not in relationship with vice versa, and being followed, as I said already, some intelligence agencies are following him and he's trying to run from them. Erotomania means loved by a famous person or personality. Like says, Gandhi is with me, he loves me, I love him. Somatic delusions. Somatic means which, related to something defective with his body. His parts have been replaced by someone and he is not able to perform, or some robot is inside him or her, which he is not able to understand. But he knows that somebody replaced all his body parts. Something like that. The other one, schizotypal. This is the personality disorder. In this, they avoid social situations, look very peculiar, unusual thinking and behavior. Unusual thinking, just if he is watching a television, he says, how people are dancing in that. I don't see people behind, but people are dancing. No matter what you say, they don't understand. They simply go behind the television and watch, and they find no one, but they come back and talk silly things, something like that. Okay. Substance abused or induced psychotic disorder. This is directly related to catatonia and unspecified catatonia, other specified schizophrenia and psychotic disorder. Substance-induced psychotic, some sort of cannabis, heroin, amphetamines, these drugs will modify prefrontal cortex, and it is very difficult for such person to use a walk constantly stable, etc. Recently, have you, if you've been following news in United States, one drug has been regularly consumed by many individuals, and they started walking zombie walk. This is because of substance abuse. There are many studies went into schizophrenia. Many studies, researchers were there, and there have been many organizations who have been into this. And this is the data collected by Gottman and McGuffin Farmer in 1987. Major family and twin studies of genetics. So now we are into etiology, sort of. The result says the spouse is affected, there are percentage of getting the other person is also, chance of getting person is 1%. Grandchildren, 2.84%. Niece and nephews, 2.65. Children, Dane children, 9.35. Siblings, 7.3. Dizygote twins, monozygote twins. So in family studies, monozygote twins were most affected with schizophrenia than dizygote. So characteristics of adopted offspring of mothers with schizophrenia. So the adopted people, both parents with schizophrenia is 27.3%, one parent 7, no parent with schizophrenia 0.86, one parent with schizophrenia, one with bipolar 15.6%. So genetically, that is biologically speaking, heterogeneous, no, not likely. No single gene affects individual to get schizophrenia. So family studies, relatives at risk. Negative symptoms have stronger genetic component. Twin studies, 44%, risk of monozygote twins versus 12% dizygote. Children of non-schizophrenia monozygote twins were more likely to adopt schizophrenia, that is 9.4% versus 1% in general population. Adoption studies increased likelihood of developing psychotic disorders. So familial high risk studies, differing in negative versus positive symptomology. As I said, no single gene effects. So 2 genes associated with schizophrenia are DTNGP1 and GR. Then other 2, COMT-BDNF, which affects schizophrenia and cognitive deficits. So genome-wide scan, there are so many other scans are going on. But replication has to be done. Then only we can get other genome sequences too. And now let us talk about neurotransmitters. Earlier, there was a theory, a dopamine theory. Due to excessive levels of dopamine, drugs that elevate symptoms reduced dopamine activity. That is amphetamine, which increased dopamine levels, can induce psychosis. Then later on, this was been revised. Excessive number of dopamine receptors instead of reduced, it was said later on revised to excessive, localized mainly in the mesolimbic pathway. The mesolimbic is the frontal side of the brain. So if this is affected, then the patient will have positive symptoms. Underactive dopamine activity in the mesocortical pathway mainly related to negative symptoms. Mesocortical is almost below the above the spinal cord area, or which is connected to mesolimbic. So this is the graphical representation. Brain injury to prefrontal cortex, dopamine neuron underactive in prefrontal will lead to negative symptoms. Mesolimbic dopamine neurons from inhibitory control is positive symptoms. Elevation of dopamine theory. Dopamine theory does not completely explain this disorder. Antipsychotic block dopamine rapidly, but symptom relief takes several weeks. To be effective, antipsychotic must reduce dopamine activity to below normal levels. So dopamine theory does not completely explain this disorder. Other neurotransmitters involved serotonin, GABA, glutamate. So glutamate, many people use this nowadays through medical practitioners to enhance their body image, which leads to psychological disorders. So brain structure under the scanners also showed us different results from the normal brain. Enlarged ventricle implies loss of brain cells correlated with poor performance on cognitive tests, poor premorbid adjustments, poor response to treatments. This is what? Normal vein, that is on your left side, normal vein, and on the right side, you can see schizophrenia affected brain. The area is bigger and, or you can say it is vacant or filled with some liquid that is affecting the performance. Brain structure and function, yes. Prefrontal cortex, many behaviors disrupt by schizophrenia. For example, speech, decision making, or governed by prefrontal cortex. Individuals with schizophrenia show impairments on neuropsychological tests of prefrontal cortex, that is memory. Individuals with schizophrenia show low metabolic rates in prefrontal cortex, failure to show frontal activity related to negative symptoms. Disrupted communication among neurons due to the loss of dendritic spine. Disconnection syndrome. I'll show you what is that. There is no proper connection, straight connection. You can see breaks or no proper connection. So this also affects the brain performance. Structural and functional abnormalities in temporal cortex. Temporal gyrus, hippocampus, amygdala, anterior signaturus. Signature. Reduced gray matter and volume evident. Disrupted connectivity in the brain. As gray matter is reduced, as I've shown you previous slide, the increased area that says the space increased says gray matter has been reduced. So now coming to environmental factors, that is socio-cultural and other factors. Damaged during gestation period. While taking birth, normal birth, sometimes, child has to be pulled through forceps, sometimes, not every time. Chances of getting injury or at the time of birth, reduced oxygen levels may result loss of cortical matter. So viral damage to the fetal brain, presence of parasites, toxoplasma associated with 2.5 times greater risk of developing schizophrenia. In Finnish studies, schizophrenia rates higher when mother had flu in second trimester of the pregnancy. Prefrontal cortex matures in adolescence or early adulthood. Dopamine activity also peaks in adolescence. Dopamine activity peaks in adolescence. So we can see the changes in adolescent age. Stress activities, HPA system, which triggers cortisol secretion, cortisol increase dopamine activities. Excessive burning of the synaptic connections, use of cannabis during adolescence associated with increased risk. That is substance abuse too. All these conditions may explain why symptoms appear in late adolescence, but brain damage occurs early in life. As we were going through, prefrontal cortex matures in adolescence age, dopamine activity also peaks in adolescence, then HPA system, excessive burning of synaptic connection, use of cannabis in adolescence. So all these things, late adolescence, but brain damage early in the life stage. And stressors. Reactions to stress. Individuals with schizophrenia and their first degree relative more reactive to stress. Greater decrease in positive mood and increase in negative moods. Socioeconomic status. Highest rates of schizophrenia among urban poor people. There were about 2 million people were studied in 10 countries. They came up with a study saying that urban poor people were most affected. Sociogenic hypothesis, stress of poverty causes disorders. Social selection theory, downward drift is socioeconomic status. And researchers support this social selection too. Family factors, yes. Cold type mother, domineering and conflict inducing mothers. There is no support to this theory, but yes, this is also under consideration from many studies. Hostility and poor communication. Hostility is where a person feels they have been deprived in many ways, and poor communication. This is also includes, many other disorders, but there are chances of getting schizophrenia through hostility and poor communication. Inconclusive at this time, but studies are going on this. Family environment impact relapse, expressed emotions, hostility, critical comments, emotions over involvements. So a person suffering with some psychological disorder, and that too with schizophrenia, has to face a lot of criticism, which definitely increases higher risk of continuing such disorder. it can be bidirectional association. Family members will be affected with the family members. There are chances of both of them increasing the disease. So what happened? There were so many developmental studies went on, and fallback studies, they went back to the people affected with the schizophrenia, studied deeply, and what they found, people with low IQ more often, boys with background of stealing or theft in their childhood, and girls who were isolated due to many reasons, maybe due to persecution or maybe suppressing or some XYZ factors. So they were affected with schizophrenia. So that is it. That concludes today's topic, schizophrenia. Thank you. Thank you. If you have any questions or queries, I would love to see them on comments. Please do comment. Okay, students, I don't see any question and answers. We'll meet in next session, that is Unit 8, Cognitive Impairment Disorders. Thank you.